Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Our guest in studio today is Dr. David Reiss. He's here today to talk with us about some of his work with trauma survivors, law enforcement personnel, and first responders when it comes to PTSD, head injury, and concussions. How are you doing today, Dr. Reiss?
Very good. Hello from Brattleboro, Vermont.
Well, thank you so much for joining us today. You know, when it comes to PTSD, we oftentimes get the immediate picture of a soldier returning home with PTSD, but there are all sorts of people from all sorts of all walks of life that can experience PTSD. Among them, people that have experienced auto accidents, people who are involved in law enforcement, or our first responders who are dealing with traumatic experiences through the course of an 8 or 12-hour shift on a daily basis.
Absolutely, absolutely. And it's not only people who experience trauma, but people who witness trauma.
Mm-hmm. Now, in your experience dealing with people who are suffering from PTSD, say a trauma survivor, I'm sure that a person who's experiencing PTSD, who survived an auto accident, as opposed to a law enforcement officer who's maybe been involved in a police-involved shooting, the dynamics are vastly different, I would say. But PTSD is still PTSD, yeah?
Well, you know, PTSD actually covers a pretty wide spectrum, and some places I think it's used too generally to refer to any kind of reaction to trauma, whereas really it refers to a specific syndrome. But the thing is, even that specific syndrome is very much colored by the person who's experiencing it, what their life history was, whether they had any traumas in the past, how they've learned to cope with things. You know, your first responder who's been trained to cope with trauma is still going to have an emotional effect, but it's going to be very different from your person on the street who doesn't see it coming and then is exposed to it.
You've worked with both. Is one more receptive to certain types of treatment than another, or can you blanket treat PTSD to a certain extent?
Last question is easiest to answer. No, you can't. You have to really do a good evaluation of the person, because regardless of what walk of life they're coming from, anybody who may have had childhood trauma, who may have, and that doesn't have to be abuse, it could be a loss, it could be deprivation, it could be psychosocial situation, it's going to respond differently than someone who was well protected growing up. And then there are definitely differences between, you know, in general, your first responders have been trained, you know, in vernacular to be more macho and to sort of hide it. And often it then comes out in a different form than the person who isn't ready for it and may show it either as a direct PTSD or turn to drugs or alcohol or other ways to try to hide what they're experiencing.
Now, we've talked a bit about pre-existing coping skills. As a healthcare provider, when someone comes to you or you encounter someone and you realize that they need your type of help with PTSD, can some of these coping skills be learned?
To a certain extent, they can definitely be learned. To a certain extent, you may have to go back to rework for old traumas. Now, that doesn't mean remembering every particular incident or every specific thing that happened, but basically people who have been terrified, and whether it was realistic or even if it wasn't real, but they just experienced the terror, sometimes you have to go back and say, well, what patterns did this set up in your life in terms of how you cope with fear? And then deal with the current acute PTSD taking into account those lifelong patterns that were developed. If you don't do that, you're basically doing cookie cutter treatment that will work for the average person, which is maybe 30%, and then the 40% on either side of that, it's not going to work.
Misdiagnosis. How often have you encountered a patient who is coming to you and says that their provider said this, that, or the other, and in your evaluation find that they've been totally misdiagnosed? How often do you find yourself undoing something that was done in error, or maybe just the physician didn't understand the nature of the head injury?
Sure. These days, it's not so much misdiagnosed as underdiagnosed, where, someone will come in with a diagnosis of PTSD, and yes, it's there, But what hasn't been diagnosed is that there was a pre-existing depression or a drug problem that was already there, or someone was the subject of child abuse or domestic abuse, or any number of other problems. Or like I had one person recently where they came in with a diagnosis of these PTSD spells, and when I really looked at it, it turned out they had a severe TBI, totally unrelated to the PTSD, actually. It was just a separate accident, and they were probably having seizures. And I sent them off to a neurologist, but I think they were being treated psychiatrically for what was actually seizures due to a head injury.
Are there any blocks to effective treatment? We talked about sports medicine, sports injuries. We talked about some of the mindset of the first responder or the law enforcement officer who's been trained to deal in stress in a certain way. Do you find that you run into barriers to treatment among certain types of people who've encountered these head injuries?
Very generally, I would say there are three classes where there are severe blocks. One is denial, where the person just won't acknowledge what they're experiencing or want to see themselves as invulnerable. I can handle this. The second one is substance abuse, and that may be prescribed drugs as well as illicit drugs, but where someone is just using chemicals to cover it up so you really can't get to what's going on. It may suppress some symptoms, but you can't get to it. And the third is fear. People who have suffered some type of trauma previously are too afraid to go there. And we'll just try to avoid really dealing with what's going on or look for a quick fix that isn't really going to work.
Now, one final question. When it comes to barriers, do you find that one gender or another is more susceptible to having these barriers for one reason or another?
Very generally, and it's probably very much more a effect of culture than it is actually related to what sex a person is. Women tend to have more fear, men tend to be more macho. I don't think that would surprise anyone. But it really goes across the whole spectrum. And at times you get very surprised. I mean, I've had some of the toughest looking men that, would scare the crap out of me, who just open up and are right there. And some women who seem very ready and willing to work, and you get to it and they're tough as nails.
Yeah. Okay. It's been great having you here with us today, Dr. Reiss.
Thank you very much. My pleasure.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.